By gently vibrating that vertebrae, it's going to restore movement back into the spine without causing pain, without causing aggravation. And by doing this, I can use specific heads on here to target one side or the other based on the alignment that I'm seeing. There's usually a response at L5 exactly linked to sacrum because that has the ligaments that attach to the lumbar spine. So most times the sacrum correction can help assist L5 coming back into place. And if it needs extra assistance, I use tools and I use hands-on by getting in there and restoring alignment. And then thirdly, we use a tool here to reduce inflammation, break down scar tissue, and help with the adjustment, relaxing the spinal muscles.